Okay, very good evening to one and all present here. This is Mukta, coordinator of Janagar Chowdi from Bengaluru. Today we are all gathered here to hear few words from Dr. Narasimha Srinivasaya on the topic uh, health, wellness and illness. Before he starts, let me give a brief introduction. Dr. Narasimha Srinivasaya's educational qualification: MBBS, MD, Academic Surgery, MRCS, MRCSI, FRCS, General Surgery, EBSQ, EARCS, PGD, MLE from National Law School of India University. He is an Associate Professor of Surgery, Apollo Hospitals, Head of Colorectal Services, Karnataka region, Senior Consultant Colorectal Surgeon, Colorectal Peritoneal and Pelvic Oncology, Laparoscopic and Robotic Surgeon, Apollo Institute of Colorectal Surgery, AICRS Director, Health Sciences Park, Bangalore. He holds 11 key positions. I'm mentioning very few in that. Head of Colorectal Services, Karnataka region, Associate Professor of Surgery, Apollo Hospitals Group, Coordinator, Robotic Surgery Program, Apollo Hospitals, Bangalore, Core Member, Care Quality Committee, Apollo Hospitals. He is the founder of Nanny Dam Organization for Wellness and Healthcare Venture and advisor for Karnataka Cancer Society, Bangalore. He has made many publications, case series, case reports, surgical techniques, research. His research, the thesis was End of Life Care, Withdrawing and Withholding of Life Support in Intensive Care Unit, an Indian Standpoint. The same was submitted to the National Law School of India University as a thesis for the postgraduate diploma in medical law and ethics and was awarded. He has many prizes and merit awards selected. Few have been mentioned for you. 2021 Deccan Herald Leading Light Award, 2021 for services rendered to the community during the difficult COVID times, receipt of cash award of 5,000 INR and a personal citation from Apollo Chairman Dr. Pratap Reddy ji for an academic accomplishment of publishing 3 papers for the year 2019. 2005, commended by Royal College of Surgeons, Glasgow, highest scores in MRCS, surgical anatomy and vascular surgery. So I had made a very brief introduction about Dr. Narasimha. Sir, please pardon me for this. Due to time constraint, I couldn't read much. So once again, welcome to All India Session Dignity Foundation online program, sir. A warm welcome to you.
Madam, very good afternoon. Ladies and gentlemen, very good afternoon. Bhaiyo aur behno, aapko mera namaskar. Welcome to Nama Bengaluru. I'm actually very humbled, madam. I think there was no need for you to introduce me at length because I feel proud to say I'm a Bangalorean, and I feel proud to say that I'm a son of the soil. You know, my father is a farmer and I still do farming. Outside my farming, I do this, cancer education awareness, and work is a sheer passion and a way of life for me. So I don't consider work as a work, but it's a lifestyle, so to say. So I was just listening to some of the chat that was going on about our Bengaluru. The weather in Bangalore is truly phenomenal. You can take a person out of Bangalore, but I can't take a Bangalorean out of a person who leaves Bangalore. So that's one thing. And they also asked what's the rainfall in Bangalore. It's about 860 to 900 millimeters in a year. So it's fairly well irrigated Deccan Plateau, so to say. Without further ado, I think to start with, I hope everybody is keeping well and safe during these difficult times of COVID. I thought we'll spend the next hour or so talking about what health is, because I think if you do not know what health is, how do we understand what not being well is? So I thought we'll give a brief outlook on what health is, what illness is, and in a sense, try and be well. Not only well, but well physically, mentally, and psychosocially. So I think there are a number of slides to get through, but I'll try and see if I can just, skip a few slides through so that we can be reasonably, simple, and we can get the information that we want rather than spending time on, unnecessary slides. So I would like to share my slides, madam, as an admin, if you could pass on the rights for me to share the slides. Mukta madam, if you can give me the admin rights, I can share my slides.
Sir, hello, sir. You have the right, sir.
You can present, sir.
Right.
Yeah, you have the right, sir.
Let me see where I can share my slides. Just a second. There we go. Lovely. Okay. Fantastic. I hope everybody can see the slide. So to start with, I always tell people, I think everything we do revolves around the nature, the mother nature. I say the cause and cure for all ailments lies in the mother nature. And it is true to say the current crisis we are facing is actually as a result of us human beings abusing the nature. I think what is important to understand is not only the nature that we have to look after, but it's also the way we nurture ourselves, the way we nurture the nature, the discipline we go through, and not to forget the importance of mind, which is probably the most strongest amongst the three factors. If you can take one slide out of my talk, it is this, I'm afraid to say. It is not the urban life that's the answer to our problems. It is not the sophisticated lifestyle we have that is the answer to our problems, but the solution lies in simplicity, the simplicity of Mother Nature, getting back to good food, potable water, clean air to breathe, and actually getting us out of all the stress. If you actually look at these slides, there are two learning points in this. I don't know how many people can understand Kannada, but I'll also try and translate to English. ಅತಿಯಾದಲ್ಲಿ ಅಮೃತವು ವಿಷವಾಗುತ್ತದೆ ಅಂತ ಹೇಳ್ತೇವೆ ಕನ್ನಡದಲ್ಲಿ. What it essentially means in English is, in excess, even nectar becomes poison. So traditionally, we have been, used to an element of affluence, although we call ourselves a developing world or a developing country. Look at this Egyptian proverb, which talks about what happens when you eat in excess. The Egyptian proverb says, a quarter of what you eat keeps you alive, the other 3/4 keeps your doctor alive. So much true and relevant to the current crisis of COVID that we are going through. Obesity, diabetes, hypertension, all these are key factors which are driving significant, severe corona crisis leading on to deaths, what we are seeing today. On the right side of the slide is talking about the impact of human intervention on the mother nature, the pollutions that we are creating, causing illnesses amongst us. Ladies and gentlemen, I want you all to close your eyes. I cannot, monitor you, I cannot supervise you, but I would request you all to close your eyes. Close your eyes and actually start concentrating on your breath. Breath has become the vital aspect of human life today. We never realized that we will be paying a heavy price even for the fresh air we breathe. The most expensive commodity today is air, oxygen. Try and take some deep breaths. Try and concentrate to feel that breath of air passing through your nose, getting to the back of your throat, going down your lungs to reach the base of your lungs. A deep breath in, you feel the chest expanding, you feel the air gushing in. Hold the breath and breathe out. A simple thing that we take for granted is the most expensive thing today. A number of people cannot do this because of the ongoing COVID crisis. Let us keep breathing in and out, ladies and gentlemen. When you're doing so, You can also start feeling your heart going, racing, lub, dub, lub, dub. When you're going through this process of experiencing the breath, experiencing the air, feeling your heart beating, think about your kith and kin, your son, your daughter, your wife, your husband, your children, your grandchildren, and think they have been diagnosed or they have been suspected to have a COVID illness and needs an ICU bed, or has been recently diagnosed to have cancer. Just think through, just experience what's going on in your minds. The heart has started racing. The breaths have become a bit shallower. There is darkness, there is pain, there is suffering, there is ignorance, and we all get worried. It is a very unpleasant situation to be in. Open your eyes, ladies and gentlemen. I think this was just a realistic picture I have painted to make you experience what one goes through and to make you realize the price of a simple breath which we take for granted. When it comes to both the communicable and the non-communicable diseases, we're talking about COVID as a communicable illness and we're talking cancer as a non-communicable illness. When this strikes your family, you've just experienced what you go through in a few seconds. Ladies and gentlemen, I do not have any disclosures to make, but I am a key opinion leader and I do get paid for my talks for a number of companies. Today, I'm going to touch on what health is, what illness is, what non-communicable and communicable diseases are. I'm going to give you a bit of a realistic picture about cancers and also the current crisis, COVID, and what we can do to make our lives better. This is what health is, ladies and gentlemen. ಕನ್ನಡದಲ್ಲಿ ಆರೋಗ್ಯ ಅಂತ ಹೇಳ್ತೇವೆ, ಹಿಂದಿಯಲ್ಲಿ ಆರೋಗ್ಯ बोलते हैं, ladies and gentlemen. It is a balance that we strike between physical, mental, and psychosocial health. So to say, we're all on the Zoom call today. We all think we are fit and well. We all think we are very, very well. We are healthy. Unfortunately, we are not. If you think about what WHO, World Health Organization, विश्व आरोग्य संस्था जो बोलती है, उसके definition से we are not healthy. हम आरोग्य नहीं है. We might be physically well, but we are not psychosocially well. Our function might not be the same. We're all in a lockdown. We're all in isolation. Our social activities have gone down. We might not have physical pain, but we are anxious. We are isolated. We are in a state of depression. We are in a state of dysthymia. There's a lot of anger in the families. Kids are losing out their precious time. And for reasons unknown, everybody's behavior is different if you actually see what's going on in your own household. So we are not healthy. We are physically well, but we are not healthy. Psychosocial well-being. We as human beings, we are used to our social lives, but we are isolated today. That itself is a factor which brings in illness in all of us. So it's a balance between all these three things and just not an absence of disease. If you look at non-communicable diseases, जो संक्रामिक नहीं होते हैं उनको बोलते हैं non-communicable diseases. जो संक्रामिक है, which passes from one person to other person, all infectious things. The one we are seeing today is a communicable disease, the COVID-19. So when we leave COVID-19 out of our equation and we take into non-communicable diseases, 60% of what we spend, the World Health Organization tells 60% of what we spend is because of the non-communicable diseases. People die and people have diseases. So I give a small example, ladies and gentlemen. I'm sure a lot of you would have heard about Gautami. Gautami was the favorite disciple of Mahavira or Buddha. When Gautami came in with the child in her arms to say, Bhagavan, please bring my child back to life, Bhagavan or Mahavir says, look, Gautami, can you go and fetch me a mustard seed from a house that has not seen death, and I'll bring your child back to life? Gautami goes, roams from house to house, town to town, city to city, and comes back having been enlightened, having been understood the reality of life. Death is the only guaranteed phenomenon, and it doesn't spare anybody. So is the case with non-communicable diseases today. Show me one person in anybody's family who doesn't have diabetes, high blood pressure, strokes, heart attacks, obesity. All these are non-communicable diseases, and every family, one of their family member, near and far, will surely have it. That's how common non-communicable diseases are, ladies and gentlemen. To add on to our misery, we have got the COVID ongoing now. So I'll briefly go through cancers for the first few minutes, and then we'll touch on COVID and the vaccinations, ladies and gentlemen. If we look at where cancer started, cancer has got a history to tell. If you go to the Indian literature or Sanskrit literature, we talk about Karkata, which essentially means crab and crab claws. So it has been there in the literature for ages, for times immemorial. So is it with literature documented from Hippocrates, the Greeks, the Romans, so on and so forth. For those who are actually not that well versed with biology, I would like to put a thought in your minds about cancer. Human body is a phenomenal creation, ladies and gentlemen. One might be dark, one might be fair, one might be short, one might be tall. हम मद्रासी हो सकते हैं या मुंबई के हो सकते हैं, ladies and gentlemen. लेकिन what is most important is the amazing creation the body is going through. The body has been made of. Human body, organ systems, organs. In organs में, no, there are tissues. मांस खंड होते हैं. Within this, you got the cells. इनको बोलते हैं जीव कण, life cell, जीव कण बोलते हैं इनको. Within the जीव कण is this nucleus, or what we call as जीव कोश. Within the जीव कोश is the data of the cell, what we call as chromatin. And this chromatin passes from one cell to the next cell without any change, and that is what protects you. In the process of damage, in the process of evolution, as one gets older, this chromatin can get damaged due to risk factors, due to age, due to alcohol, due to smoking. And any of the risk factors that damage that chromatin leads to a bad cell. That bad cell becomes uncontrolled, and it grows at a very rapid pace, multiplying without getting controlled. It becomes a lump, and this lump is nothing but a cancer. So essentially speaking, cancer is a part of evolution. And if you live long enough, you'll probably have one or the other type of cancer. And every cell in the body has got the ability or the capability to become a cancer, ladies and gentlemen. People who smoke have oral cancers, lung cancers. Women folk, especially in a city like Bangalore. Bangalore is called as the breast capital of India. Girls in their 20s and 30s are getting breast cancers. What is this because of? Because of the lifestyle, smoking, alcohol, obesity, oral contraceptive pills, not getting married early, not having children, not breastfeeding, so on and so forth. Fast food, lack of fiber, red meat gives rise to bowel cancers. And obesity is one of the biggest risk factors for a number of cancers, ladies and gentlemen. We are seeing a lot of cancers these days. It is directly proportional to the urban clusters we see because of the lifestyle. It is causing a lot of death and a lot of disability, ladies and gentlemen. This is a slide which is very busy, but the summary of this is there's a linear correlation between the urban cities and the cancers we see. I wouldn't go to the details of this, but what it says is, if you go to urban clusters, you do see a lot of cases. And this is just a age correlation, which says, as you become older, you'll have more chances of getting cancer. So if you live up to about 75 years in Bangalore, 1 in 7 women can have a cancer of some type. And actually speaking, we all have the right to live, and it is our responsibility and job to cut down the risk factors that causes us cancers. Historically, cancer work has been done for ages immemorial. The chemotherapy trials and research started after the Second World War. People are constantly working at cancer care to make life better. And the next 5 minutes, I'll take you through the journey of cancer care, ladies and gentlemen. I just spoke to you a few minutes ago about one of your family member having a cancer. If that happens, what will be the impact on the family? What does the family go through? What does the patient go through? and how the cancer journey pans out, I'll speak to you in the next 5 or 10 minutes or so. What is important for all of us is to understand what symptoms are, ladies and gentlemen. ಲಕ್ಷಣ ಬೋಲ್ತೆ ಹಿಂದಿ ಮೇ ಕನ್ನಡದಲ್ಲಿ ಲಕ್ಷಣ ಅಂತ ಹೇಳ್ತೇವೆ. ಈ ಲಕ್ಷಣ ಅಂದ್ರೆ ಏನು, what is meant by symptoms is important to understand, because that is when you can understand the symptoms, get to the doctor soon, get it early diagnosed and have a cure for cancers, ladies and gentlemen. And how the diagnosis happens, how we decide on what treatment to go for, how do we treat cancers are some of the things I'll talk you through in the cancer journey, ladies and gentlemen. So if you look at it, what are symptoms? Let me give you an example. Abhi, I stay or I work on Banagatta Road. Because of the lockdown, the number of people are less on the roads. But when it is an active, busy period, you have enormous amount of people around this part of Bangalore. And if you bring in 1 lakh people, which essentially translates to 100,000 people, 1 lakh logon ko leke aiye hospital mein, and you screen all of them for cancers, there will be about 5 to 6 cancers, or maybe 6 to 8 cancers you pick up in the whole 100,000. 1 lakh to badi number hoti hai, and it's a lot of people you have to screen to pick up 6 cancers. On the contrary, ladies and gentlemen, I tell people, please come if you have cough, if you have blood when you're coughing, if you have got blood in your stools, and I'm trying to tell them, if you have these risk factors, if you have these symptoms, please come to me. And I pick up 100 people on Banarghatta Road who got bleeding through the back passage, who've got blood in the sputum, who have been losing a lot of weight, who have got a lump in the breast, and who have had change in their bowel habits. You bring 100 people of these symptoms, ladies and gentlemen, you will still pick up 5 to 6 cancers. Look at the difference. You pick up 100,000 people, 1 lakh लोगों को लेके आए आप अस्पताल में, आपको मिला 6 कैंसर. 100 लोगों को लेके आए जिनको लक्षण था, and you still have about 5 to 6 cancers. That is the difference between picking up a symptomatic population and a general population, ladies and gentlemen. So what are symptoms? Lakshan kya hote hain? Symptoms are those manifestations which are not normal to oneself, which cannot be explained by a reason, and which have been persistent for 4 to 6 weeks. So लक्षण क्या होते हैं? लक्षण वो कंप्लेंट से जो आपको नॉर्मल नहीं है, जिसको हम एक्सप्लेन उसके कारण बता नहीं सकते, और 4 से 6 हफ्ते तक चली है, इसको सिम्टम बोलते हैं. अभी समझ लीजिए कोई धूम्रपान करता है. धूम्रपान जब करते हैं लोगों को खांसी तो आ जाती है, लेकिन इस बार खांसी के साथ उसको खून निकल रहा है खांसी में, और ये खांसी कम नहीं हो रहा, 4 से 6 हफ्ते तक चल रहा है. दूसरी बात, अभी मेरा मलमूत्र में जो खून निकलता है वो नॉर्मल नहीं है. अभी हर दिन में 1 बार मल विसर्जन के लिए जाता हूं, लेकिन अभी 3-4 महीने से 4-5 बार मल विसर्जन हो रहा है, और उसके साथ साथ खून भी निकल रहा है. दिस इज अ सिम्टम, लेडीज एंड जेंटलमैन. So it is important when you have symptoms, you go to your doctor rather than becoming a Google doctor. We're all pretty good at Googling, no doubt, but we think we are our own doctors, which is not the right thing to do. Kyunki the moment you Google, there are 2 things that happen, ladies and gentlemen. Google bolega rule out cancer. The moment it says rule out cancer, हो गया. जो भी आरोग्य थे, जो भी दैहिक आरोग्य था उनका, मानसिक आरोग्य था, अभी तो उनका मानसिक आरोग्य तो अस्वस्थ हो गया, ladies and gentlemen. People who Google things, the Google tells you 2 things. It could be cancer, and it does 2 things to the human being. One, you start running around doctors to find out what's going on, and the second thing it does is it makes a well person a worried well. So from a physically fit person, you become a mentally unwell patient, ladies and gentlemen. This is what Google does. So I would recommend that you go to a clinician who can sit with you, talk to you, separate the dust from the gold, put you through the right tests, and pick up a cancer if there is one, and treat it at an early stage. So this is what happens. And now the next stage is, if there is a lump, if there is a lump in the breast, lump in the uterus, lump in the bowel, they pick up some tissue, have a look under the microscope, and they see what I explained to you, a number of cells which haven't got an organization, which are irregular, which doesn't have a right shape, and that is the diagnosis of cancer. Once the cancer is diagnosed, we put you through a tumor board. बहुत सारे डॉक्टर लोग होते हैं, 10 से 12 तक होते हैं डॉक्टर लोग, एक कमरे में बैठ के आपके बारे में बात करते हैं, और ये बताया जा सकता है कि इनको कौन सी ट्रीटमेंट बेहतर होगी. So people always find it difficult to do the right decision when it comes to cancer, and when it is decided in a tumor board, it makes the treatment much simpler, and it makes the right treatment go to the right patient rather than having treatment, unnecessarily in a number of cases, ladies and gentlemen. Once it is done, you go through the treatment aspect of it, whether it's an open operation, robotic operation, it doesn't matter. You go through the treatment, and we actually follow up these patients for 5 years to make sure, if a cancer comes back, then that can be dealt with. So the symptoms that briefly are head and neck cancers in a smoker, lung cancers in a smoker, female cancers that can happen, because of uterine cancers, vaginal cancers, cervical cancers, so on and so forth. I've talked to you about the symptoms, about the investigations and how it works out. I briefly talked to you about how we stage, how we diagnose cancers. I'll tell you what staging is in a minute. Staging is essentially a process of evaluation to say whether the cancer that has taken birth is just there, or has it grown, or it has grown and has spread to the lymph nodes, or it has grown, spread to the lymph nodes, and has spread to the organs far away from where it has taken birth. If it is spread far away, stage 4. If it is spread to the lymph gland, stage 3. If it has become bigger in the place of birth, stage 2. And if it is just there as a small lump where it has taken birth, stage 1. So what we want is stage 1 and 2. Once it goes to stage 3 and 4, then we need chemotherapy, surgery, so on and so forth. So I think decisions are difficult than incisions, ladies and gentlemen. And I think it is important to understand that cancers are probably a normality as a growth of evolution in human beings. And I think it is important to take the right decisions when we are faced with a condition like cancer. It is always difficult for us to make decisions. Whatever it is in life, whether it's about just getting married to somebody or buying a house, to making cancer decisions, I think they are the most difficult ones compared to the action that arises out of our decision, ladies and gentlemen. We live in a smaller world these days because of globalization, and decision making cannot be replaced. Experience, knowledge, intuition, all these play factors in decision making. What we have to understand, ladies and gentlemen, it is not the cancer we are treating, we are treating a person who is harboring that cancer. If two people have the cancer, one is 40 and one is 80, maybe the right thing to do for the person who is 80 is to leave him alone or do minimal, because he'll probably live for another 2 years without any intervention. So it is not about treating cancers, it's about treating the patient with the cancer. This doesn't spare the rich, it doesn't spare the poor, it doesn't spare the royals, it doesn't spare the sportsmen. So, but what it leaves is, ladies and gentlemen, 3 categories of patients: the winners, the losers, and the fighters. You should always be in the fighters and the winners group and try and avoid the losers group, ladies and gentlemen. And a lot of it is to do with the mindset. A robust mind you have, a robust immune system you have, and you probably will fall into fighters and winners rather than losing. So it's important we have good social support. We actually feel that we will win over. Yoga, meditation, all these things truly help. When it comes to operating, we can do open operations, we can do laparoscopic operations or robotic operations, but all the roads lead to Rome. So it's essentially, we are achieving to remove the cancer, but it doesn't matter which way you take, but all of them should be at the aim of removing the cancer. In addition to surgery, we can have radiotherapy, chemotherapy, hormone therapy, and immunotherapy. After the cancer is sorted out, we send patients home, follow them up for 5 years, so that if there is a problem, we can attend to it. And the difference between picking up an early cancer and late cancer is this, ladies and gentlemen. An early cancer, you treat at the end of 5 years, you have 95% of the population still alive and healthy. And if you're treating a late cancer, you've got 95% of the people dead at the end of 5 years. That is what the difference between early and late cancers is. So the key here is the symptoms, Lakshan hai. You pick up symptoms, see a doctor rightly, soon, pick up an early cancer, get it treated, and you've actually cured a cancer. Quality assurance is one thing, but that is for us more than you. And what we do is just not important. What we do, we have to propagate that, we have to talk about it, and we have to teach people. In essence, I think we need to not only do what we do, but also tell people what we do. I think if we can all work hard, if we can leave this mother nature in a better place, if we can reduce the risk factors that cause cancers, air pollution, water pollution, stress, anxiety, obesity, I think we would have done a good job, and we should leave this mother earth in a better shape for the future generations to come, ladies and gentlemen. I hope that gives you a brief outlook on what cancers are, which are major non-communicable diseases, what we see today, ladies and gentlemen. If you all want to stretch your legs for a minute or two, grab a coffee or water, you can take a 1 or 2 minute break, and then I'll start with the communicable disease, the COVID-19, in 1 or 2 minutes. Is that okay? Hope that was useful. It was a brief, quick run through. I still have 25 minutes to go, but I know that we all like a bit of a stretch. Stretch 1 or 2 minutes, get a glass of water or coffee, and then we'll move on to communicable diseases, and we will talk about COVID-19 and the precautions that we need to take in addition to some information about vaccines. So we'll probably come back in the next 3 or 4 minutes so that we can catch up with COVID-19. I hope that's okay. And then we'll see you back in about 3 to 4 minutes, ladies and gentlemen. Is that okay, Mukta?
Yes, sir. No
So
problem.
just stretch your legs and maybe get a coffee or a tea, and then we'll have another 20-25 minutes. Because I know I'm just running a bit faster, but I think a bit of a break in the middle will be helpful.
Okay. Sure. Those who are joining just now, so there's a break given by doctor. In another 2-3 minutes, he'll start the session. So you can have a break.
Mukta, are we ready? Mukta,
Sir,
are we
you
ready?
can start, sir. Yes, sir.
Lovely, lovely. I hope you had a bit of a breather. Okay, so moving on from cancers, what we call as non-communicable diseases, we are moving on to something called as COVID crisis, COVID-19. COVID Mahamari bolte hai ise. It's a pandemic. I will give a brief outline about what we should do. I'll try and clear some of the misconceptions about the vaccinations and try and answer some of your questions in the last 5 or 10 minutes to whatever my ability is to clear your doubts and questions. Let us move back to our presentation and move to our slides on COVID-19. Lovely. So going back to about 1.5 years ago, we started seeing essentially a viral illness affecting predominantly the respiratory tract or श्वासकोश जो बोलते हैं उसका एक virus which started causing significant impact on the whole world, and that is the reason it's called as pandemic. We think it started from a place called as Wuhan. These slides are probably not relevant now because everybody knows about them now, the symptoms. How do we prevent, spread from one to other? But we're already in a state of pandemic. Tips which you probably can educate a lot of people about: keeping fit, drinking good water, keeping up the social distance, washing your hands, so on and so forth. And there's a lot of help out there. Suppose if your family has got anybody with COVID, how do you deal with it? Who's the first port of call, so on and so forth. I think this is probably, all known for a majority of us. So is the tests, because we do know that there are two types of tests. One is the throat swab we do. Amongst this, there are two types of tests. One is a rapid antigen test, also called as a RAT test, where they're looking at the protein that is present in this virus. And the other one is called as an RT-PCR. If you expand this RT-PCR, it stands for reverse transcriptase polymerase chain reaction. So if you can go back to that DNA material I showed within the nucleus, it's a similar sort of protein where we are amplifying it, we are increasing it and trying to see whether there is virus in the throat swab. The other test we do is to look at the antibody, but that is seen in the blood. It will only tell us if there has already been an infection or you're vaccinated. Rest of the questions, are probably self-explanatory and the answers you already know. So treatment for COVID is essentially symptomatic. You give antivirals to an extent, you give anti-inflammatories, you give zinc supplements, you give vitamin supplements, and you give anti-inflammatory medications when people are severely ill to counteract what we call a cytokine storm. And majority of the cases are asymptomatic. So if I can put your fear aside, ladies and gentlemen, let me give you a brief statistics. If there are 100 people with COVID, probably about 90% of them get better with not much happening. They get better with supportive treatment at home. Among the rest of the 10, some of them go to COVID care centers or supportive care centers, maybe about 4 to 5. 2 or 3 land up with, significant illness, going to ICU, and they pull through, and we probably will lose 1 or 2 people out of every 100. That is roughly the statistics we are seeing with regarding to COVID as such. It is true to say, bhoot se bheet zyada hai. So it is true to say the fear is more worse than the foe. It's predominantly the media driving this fear, because what is happening in the urban clusters, it's not the same thing as what is happening rurally. And what we are seeing in India is certainly not to the same scale what we saw in Europe not long ago, ladies and gentlemen. But this is the current state of affairs currently seen in our urban clusters. Your heart sinks. What actually makes you shed tears? What actually makes you think that is this a life worth living is the lack of closure to one's life. We talked about right to life. Constitution gives that right to us on Article 21. The Constitution doesn't give, the liberty, the rights to have a right to dignified death. And for a lot of people in this COVID crisis, having a dignified death, having a closure, having an ending is not there. And I think that is what hurts, ladies and gentlemen. This is some research evidence or data that comes from Johns Hopkins University. The data goes back to just about a week ago now. If you actually look at it, on the 27th of April, the number of new cases in India was about 360,000, a lot of cases. The 7-day average was about 3.5 lakhs, ladies and gentlemen. If you look at state-wise cases recovered and deaths, Karnataka, so we had about 1.4 million cases. About them, 1.1 cases had recovered. Some were still in the process of recovering, and we had about 14,000 deaths. Vaccinations, something that we should be proud about. The India's vaccination program is the largest in the world. And on that day, on the 27th of April, we had about 9% of the total population who had at least one dose of vaccination, and about 2% of the population who had both the doses of vaccination done, ladies and gentlemen. People have a lot of questions. People say Covishield, Covaxin, Zydex. Which vaccine to take, doctor? I get about 25, 30 calls every day. Which vaccine to take? Is it safe? What is the risk factors? Ladies and gentlemen, I think India is a money-driven country, and sometimes we read into things too much, not being experts or specialists. I get phone calls to say, from general population to say, oh, should we be giving you this? So I tell them, I seek help from my medical specialists as a doctor. So I think we should leave it to the specialist to decide and allay the apprehension associated with the vaccines. What is surprising, which I didn't know before this, was we think the COVID virus came in from China, but going back historically, even the first vaccine was described in China going back to a good couple of hundred years ago. 16th century, the first mention of preventive inoculation in writing was from China for smallpox. How coincidental it is. And the vaccines go through rapid, trial process from preclinical stage to the stage it gets approved after safety trials, ladies and gentlemen. How do they work? I said to you, it is nothing but a protein, this virus. So the body has got the ability to generate antibodies against this protein when it gets to the body. So when we prepare a vaccine, either we make this vaccine so weak that it cannot have a disease, but it can trigger the immune response to produce antibodies. Either we give killed protein or a suppressed protein from this virus. That's what produces antibodies, and that is the whole process how vaccines are prepared, or the intention of the vaccine is to produce immunity in your system. The vaccines are nothing but virus in a form, either it is dead or it is weakened to an extent that it cannot produce the disease, but can produce the protection against the disease. That is the basis for vaccines, ladies and gentlemen. Currently today, we are going through about 8 different vaccines in India. The top 2, or the Covishield and the Covaxin, are the ones which are aggressively being marketed and aggressively being given. So the first one, the Covishield, is a collaboration between the Serum Institute of India and the Oxford University from AstraZeneca. And the second one is a homemade one from Bharat Biotech based. The person is from Bangalore, but based in Hyderabad after a stint in the West. So we have a lot of information, literature on vaccines, but generally speaking, you have a bit of a fever, a bit of a temperature, a bit of a pain, a bit of an ache. These are some of the side effects of any vaccine per se. There was a lot of news about Covishield causing blood clots in the system, but it is not statistically significant, which means the number of people with these side effects was far and few. So it is truly not a major problem, so to say. The literature itself is very extensive, but for a common man, what I would advise is, if you're not immunosuppressed, if you're not going through chemotherapy now, rest all of them can have these vaccines. And I think data is supporting that vaccines are probably the most safest thing that we have done to prevent life-threatening illness from COVID. So this confusion dilemma about whether I should take a vaccine or not is not new. And if you go back to the times again in 1892, people have been debating the same thing about vaccines, whether to take or not, when people had been, troubled by a lot of pandemics in the past. Again, going back to my slide of talking about decision making, it's the difficult thing to always decide to go to the vaccine or not, given what goes on with the media and what goes on with the community and the people. I think we should be proud to say ours is the largest vaccine drive in the whole world. There's a lot of information on the above websites mentioned, and a lot of information is given on vaccinations. And if you look at it, you can track this real time, number of cases from each and every state. You can track them. The system is so robust now. I think what is that you, me, and us should do, especially in the given state of difficult COVID crisis, ladies and gentlemen. As a population, we should be creating awareness to people. We should be seeking advice if there is any element of doubt on symptoms of COVID if we have. What are the symptoms? It could be tiredness, diarrhea, runny nose, loss of smell, loss of taste, unsettling fever, sweating, exposure, so on and so forth. I think if any of these things happen, it is important not to just sit at home, but to seek help from the doctor or seek help from the hotlines. And prevent risk factors. Don't go to the market. Don't mix with people now, especially during this time of pandemic when things are spreading rapidly. And what are the pitfalls, ladies and gentlemen? The pitfalls are false reassurance. Arey yaar, 2-3 din se bukhar hai, goli khali kam ho gaya yaar, it's okay. That is a pitfall. You've had no, arey yaar, test to karali mein nahi, test to negative hai, the RT-PCR is negative, a pitfall, because these tests are only 70 to 75% sensitive and specific. And if things are not right, please go down to the doctors. Please get somebody check you. Please repeat the test. The whole problem now has been the younger people who are actually falling into these pitfalls, thinking that they're fit and well. I'll give you an example of a lady who's 36 years old with 2 children, the youngest being about 18 months old, who actually died because of a lack of ICU bed 2 days ago in Bangalore. And the saddest part is, that person's brother-in-law is actually operations manager, and he couldn't get a bed in the hospital. Such is the dire state of affairs. So I think it is important that we are aware of things and seek help at the right time. As professionals like me, we are creating that awareness and trying to direct people to the right resources at the right time. As policymakers, the government has got a huge responsibility to get the infrastructure ready, to get the resources ready, to get the oxygen ready, to give the doctors, the nurses, so on and so forth. And I think it's very important that we bring in discipline in the community about masks, social distancing, lockdown, so on and so forth. And I think it's important we provide support to the people to say, keep yourself fit, keep yourself functionally well, and also not to forget the simple things like eating healthy food, drinking healthy water, exercising, prayers, yoga, so on and so forth. I think this is some amount of evidence, ladies and gentlemen. Post-vaccination, which means people who've had the vaccines already, look at the number of positive cases after that. Whether it's Covishield or Covaxin doesn't matter. But if you look at the Covishield, the nearly 12 crore people have been vaccinated till now. And the number of people who have actually become positive after the second dose of vaccine is 0.03%. Imagine that is how effective vaccinations are. So please, you should all get vaccinated if not already done so. You should encourage the younger people to get vaccinated, because now we are not seeing death amongst elders because they're all vaccinated. We are seeing death amongst the younger people because they are the ones who are actually struggling not being vaccinated. So encourage vaccination, and actually, it doesn't cause harm. It might cause some minor side effects, but not to an extent that, it kills people, no. And this particular worry about Covishield, about blood clots, I think it's been taken a bit too far. The incidence is very, very less, and it's not statistically significant. So ladies and gentlemen, what is that you need to do? Simple things which comes at not much of a cost. Fresh, home cooked, nutritious, healthy diet, a good walk in the air, good drinking water, steam inhalation, and meditation for your mind. If you do these things, ladies and gentlemen, majority of the times, 99% of the patients with COVID are actually okay. As I said to you, it's not about a civilization that we are doing. It's not about the practice we are creating, but it's also about documenting the evolution or civilization. So it's important for us to translate what we do and bring awareness among the people. So ladies and gentlemen, it's actually not all that bad. The initial few seconds of anger, anxiety, darkness, fear is all overcalled. Actually, there is hope, there is life at the end of the tunnel. It's all about being strong, and happiness is out there. It just needs a bit more thought, understanding, and patience. I think let us be the change we want to see. Let us arise, awake, and stop not till the goal is reached. Let us make this world a better place for all of us to live, and let us leave this in a better shape for the future generations to come. One more last time I say, decisions are more difficult than incisions, and I'll leave you with piece of work that I did when I did my research going back to about 10 years ago. I'll be happy to take any questions at this point. Thank you for your attention and thank you for your time. We're just on time, 5:27, and I can take some questions according to your convenience.
Dr. Saab, this is Harish Sujan from Mumbai.
Yes, two questions.
I'm 79 years. It is not a question. I'm nobody to question you, but a query regarding Covishield. The time difference is given as 6 to 8 weeks. Now, even after 8 weeks, the Covishield is not available. Then what?
It is something the policy makers have to answer. So there has been a lot of work done to say whether 4 weeks is better or 6 weeks is better. But if there is no availability, not a problem. It can be delayed by another week or two. It is not a big problem at all. But people saying that yes, I want Covishield, yes, I want Covaxin is the wrong thing to do. Whatever you get, you should take it. If there is a delay in 1 or 2 weeks, I don't think it's a good thing. I hope that answers your question, sir.
Thank you so much.
Question. I have a question.
Please, sir.
Doctor, this vaccination is only first and second dose, or it has to be repeated every 6 months or 1 year or so?
Sir, we don't know is the answer. See, we are talking about mutations happening on this virus. And, with time, the virus has become very, very weak and the immunity builds up in the community. That is what we call it as a herd immunity. People say maybe it might become like a flu virus, which you might have to take once in a year or once in 2 years. But the answer is we don't know. It all depends upon how long the antibodies will stay in your body. It's too early to say, and I think time will.
I have a question. Hello, sir.
Thank you.
Hello.
Sir, if you can all mute it, and whoever is asking a question can unmute and ask a question, sir.
Yeah, I want a question.
Please.
I
could understand from your.
Hello. Can I ask a question, please?
Please, sir.
I had a corona last year, mid-September. And that time, antibody test was done. It was 45 value. I was okay. I'm quite okay in the second phase. I'm at home totally. And I took first dose of Covaxin on 24th of April. So after that time corona value was 45. And again, before first dose of vaccine on 24th April, I took the first, the value was 155. And then I took the first dose on 27th April. Again, my 6 weeks are over on the 10th of May. So I approached my doctor. So he again asked me to do the antibody test, which was done. This Covishield antibody test. The value come to 188. My second dose is due after 6 weeks on 10th of May. And 8 weeks will be over on 22nd May. My doctor says after the value now was 188. So he said your antibodies are high. So you hold on. So I said when the antibody test has to be done again before taking the second dose, so he said maybe. So he asked me to hold on. So I am holding on. 10th May is getting over on, and I wanted to check the hospital that is available. So he has stopped me. So he said antibodies might have to be repeated. So when this antibody test has to be done?
Sir.
Second dose is due on either 10th May 6 weeks, but he asked me to stop. Hold on. Okay, wait, don't make anything for second dose.
Sir, everybody's body differs when it comes to immune response. So if you actually break down the problem, what are we doing by giving in a vaccination? We are injecting the virus in an inactivated, in a weakened form to the body so that the body can recognize this and generate immunity. That is what we are doing. So the first dose of vaccine will sensitize what we call as T cells in your body. There will be something called as memory cells which store this information within them. And when you have the immunity starts generating and the antibodies will start generating. But when you have the second dose, that is when there's a robust response for the body to produce more antibodies. So that is the reason the second dose is recommended, so that the body's memory is triggered and more cells, more antibodies coming. In your case, I do not know that you might be exposed and you might have been asymptomatic from a natural infection without the vaccine. Or you might have the vaccine and also had a natural infection, which is what could explain a very high counts. The bottom line is, sir, you don't need to scratch your head and worry about it. If you've got enough antibodies, you don't need to worry too much. Stay tight, stay fit. If we don't know how long the antibodies last, people say it can go up to 6 months or 9 months or whatever. So the answer for your question is worry less. If you've got good antibodies and you've had only one vaccination, stay put till the doctor says the next month. But what you should not do is get worried about it and lose your sleep about it, sir. Hope that answers your question, sir.
There was some sound, some undisturbance. I could not hear the last thing.
Sir, I will give you my number. You can give me a ring later on for the benefit of all. We'll probably call it a day for your question. I'll give you my number and you can give me a ring later, sir. Any next questions, please, sir? There are a lot of questions asked.
Yeah, okay, sir.
It's a person. Okay. Let me go to the chat box. There's a lot of questions.
Doctor, can I ask a question?
Madam, yeah. So I'll come to you in a minute, madam. Let me answer these questions. Can everybody mute your speakers, please?
Sir, from the chat box, you reply, sir. I given it in the...
Correct, sir. So just mute your question, mute your speaker, sir, and I'll come back to you in a minute. Just mute your questions.
I given it in the chat box.
Lovely. I'm really grateful to the compliments that I have received. I'm really grateful. I'm indebted and I'm humbled. And the bio break always works. I think I love it because when my body needs a break, it means that everybody needs a break.
It was a beautiful session, sir.
Thank you, sir. I think the instrumental melody is a good idea. I'll take that on board.
Hi.
Okay, now moving on to questions. Mr. Kashi.
I have a question.
Madam, I'll come to you, madam. There are questions here. Mr. Kashi asks me, I have read that UK has increased the gap of about 12 weeks and found good result.
Hello.
Okay, so madam, see, yeah, as I told you, it all depends upon the immune response. Anything more than 8 weeks is good enough, and I wouldn't change what we are doing currently. The next question that is asked is, if a person is uncontrolled diabetic, is it safe? Yes, it is safe. All the more important that you take the vaccination when you're a diabetic, because when the corona hits you, it hits you badly with diabetes. So all the more important to take the vaccination if you're diabetic. What about the nasal spray? It's a good idea. How much it has materialized, I don't know. You should inform me whether it is materialized. I don't know is the answer. Can one travel after the vaccination dose? What is the time frame that one needs to keep before going for a kind of travel? I think anything after about 6 to 8 weeks after your
Hello.
first, madam, just a second. Anything after your second vaccination, 1 or 2 weeks after that, you can travel. COVID-19, we are hearing news stating it's airborne. I don't know. I know as much as you do. You know, there are a lot of literature coming about airborne, but the answer is, you know, I know as much as you, and hopefully time will tell. The next question is about COVID sneeze, and it dies and bounces back. Well, I think we have answered this question a fair bit. It's a droplet infection, we think, and that is the reason it's all about cough and sneeze and, you know, anything that deals with the droplets, whether it's airborne. A lot of studies are telling it could be airborne, but as of now, the decision is not made, and we are still waiting to hear more from the scientific world. Now I can take more questions, sir. We'll have a few more questions before we close this session.
Sir, the injection has been found out there. Is it true, sir? There is an injection immediate for not vaccine, an injection. If a person is affected with COVID-19, an injection has been found out or something. Some morning.
No. So what you're talking about is, sir, you're talking about an injection called as tocilizumab or an injection called as altuzumab. So what are these? These are essentially blockers. These are essentially like a magnet for the bad molecule which is generated as a consequence of inflammation in the body. See, when COVID infection hits you hard, the body, the human body, in the process of protecting itself, produces a lot of soldiers. These soldiers are nothing but cytokines. These are cell messengers. These are proteins. So in the process of fighting to protect the body, they cause a lot of damage to the body. They cause lung failure. They cause heart failure. They cause, to protect them, we are putting a molecule into the body to go and block these cytokines or messengers. This is called as interleukin 6 blocker. This is called as tocilizumab or atezolizumab. So these are expensive molecules which had been used for other problems in the past, like rheumatoid arthritis and so on and so forth. But now we are using this for COVID crisis when people are not well. So it's a molecule, it's an injection, it's an expensive injection, can go up from anywhere to 40,000 to 90,000 rupees. But some evidence is there to say that helps. I think that is what your question is, sir.
Yes, sir. Well, what about hydroxychloroquine, sir? Though much this thing are.
Sir, there is not much of evidence for hydroxychloroquine, but people are using it. What is truly of some use is the steroids we are giving, because these are all ways of suppressing the immune system. These are all ways of cutting down the messengers. These are all ways of stopping the soldiers going and killing our own body. That is what we are doing. So it is like you have an enemy in your body who has passed through your fields, and suddenly you have lighted fire to your own farm in the process of holding on to the enemy who has come and gone. But the enemy is gone, but the field is burning. That is what is happening. And we are trying to dampen this fire, put this fire off by giving immune suppressants like the steroids, like the tocilizumab, like the altuzumab, etc. Hope that answers your question.
Hello, can I get a chance? May I
Please,
get
madam.
a chance, please?
Please,
Hello?
madam. Go ahead, madam.
Hello. My question is, that the coronavirus, the structure of the virus is that of a crown, okay? And the crownlets or whatever they are, it is in that particular factor that the virus exists because of its protein content. Now the protein content is a kind of a nutrient. Now, can this nutrient be harnessed, and can this be caught, and that could be used as a control measure for this virus?
Madam, I suspect you have a science background. You're talking to me as a bioscientist.
Yes, I'm a biologist.
I know, I can sense that. I'm a very simple surgeon, but I'll tell you, there is sense in what you say. The virus has got different.
The genome has to be attacked.
Virus has got a lot of proteins on it, madam, the surface proteins, and we call them spike proteins.
Yeah.
So I think it is these spike proteins which are going through mutations, which are changing. See,
right.
And we are seeing
can we get to the base of the nutrient?
You can, madam. There are a number of ways we can deal with it, but time has been a factor, and it's all been a new experience for all of us.
What I thought was, it may sound absurd, but if the nutrient could be harnessed and that nutrient to be extracted or isolated, maybe that nutrient, the killing of that nutrient might help us towards the control. It sounds absurd, but there it is.
No, madam, I'm really privileged to hear to a person like you. But yes, I mean, the thought process is right, but I'm sure somebody has already thought about it. But it is certainly out of my limitation to do anything with the comment you have given. I have certainly taken this academic comment, with a bit more thought into it. but maybe it is something you can write to people like Biocon or people like these companies, because they have Twitter accounts and they have contact IDs.
Right. I need a guidance, please.
Madam, I'll give you my number later on and you can connect to me on that number, madam.
Oh, thank you very much, doctor. Thank you.
Okay, madam. Okay, madam.
Hello, doctor.
Doctor, can I speak? If you don't mind, can I speak, doctor?
Please, madam.
1 minute, I'm sorry. Good evening, doctor. Doctor, I just wanted to speak about my mom. She's Maya Motwani, who's into a Degree Foundation, a member. She has a GERD disease last year. And can she go for a vaccination injection? Is it any problem if she can go for that?
Sorry, madam, I missed your question. Repeat that for me.
She had GERD, GERD, GERD disease last year.
She had GERD last year.
GERD, GERD disease. Okay, last year. Due to till today, she's not able to eat anything spicy or anything. She's just having light food, very, very light food.
Madam,
and
okay.
She had vertigo
Got your question. Madam, GERD, also called as gastroesophageal reflux disease, is not a disease. It is a condition.
Okay, sir.
It is a condition where the gullet, the food pipe, is a bit shorter at times, and the stomach, which should be down in the abdomen, is slightly higher up, because of which the valve mechanism is weakened and the acid comes into the gullet. So it is not a disease, it's a condition. So there is no contraindication for her to be vaccinated. So she should get vaccination done.
She had one more. It was like second level of fatty liver plus vertigo also she had in November.
Not a problem, madam. She should have the vaccination.
Oh, thanks a lot, sir. Sir, there's one more question. Can I ask, if you don't mind? It's about me.
Please, madam.
I'm a daughter. I have a gallbladder stone, and I'm highly constipated. Highly means highly constipated from childhood. So
yes, madam, you can have the vaccine too.
Okay. Thank you, sir. Thank you very much.
Okay, madam. Okay, any more questions?
Is there any nitric oxide treatment or something very effective? Someone was is it true?
Sorry, sir?
Nitric oxide.
Nitric oxide.
Yes.
Sir, there is no one molecule not being told that it is not good for corona. See, we deal with a lot of people, and Ayush people say this is good. Somebody says, Nimbuka ras is good. Somebody says cow urine is good. Somebody says, the mitti is good. Sir, it's all hit and throw. But what is science? Science tells us you reduce the inflammation, you cut down the inflammation, you prevent its spread, and support the system with good nutrition, good mental mindset, meditation, prayer, walking, good oxygen. I think that is what will help.
Thank you.
Doctor, they say that the symptoms of the first wave COVID and the second wave COVID is different. Is it true?
Madam, I think the symptoms are probably the same, but they have various manifestations, madam. See, in the initial wave, we had a lot of upper respiratory symptoms, but now we don't see them much. The reason is we have been keeping our upper respiratory symptoms fairly clean, and the viruses go through mutations as well. Now we are seeing more primary presentations with lung pathologies. So where the virus has gotten deep into their lungs, escaping or bypassing the upper respiratory tract. So yes, the manifestations are changing. Like we are trying to play with the virus is trying to play with us. So the answer is yes, but not to a great extent. So anything out of norm, you should suspect and get the test done, madam.
Doctor, can you answer chat questions?
What are the symptoms
Chat
of
questions
the
can you
second
answer,
wave?
sir?
Then what are the symptoms of the second wave then?
Madam, any cough, any fever, any temperature, things are not settling down, blood counts that are going up and down, you have to get to the doctor, madam.
Thank you very much.
Madam, let me just answer these chat questions if it's okay, madam. So
yes,
after taking vaccination, what are the common symptoms noticed and how long it will persist? Sir, any viral infection will have some amount of tiredness, aches and pains, cough, a couple of days of fever. This can happen after vaccination. It is just your extreme fatigue. You're very, very, very tired after the vaccination in majority of the people. So you expect that for 2 or 3 days after the vaccination, and then it should go away, sir. So that's what I think, the answer for your question is. So minor symptoms related to any viral infection last for about 2 to 3 days. Okay.
Doctor, they didn't have any contraindication after the vaccination. No pain or fever, anything. Was it? You mean? Does
No,
it mean?
see, I didn't have any symptoms after the vaccination. So it depends upon individual, madam. It depends upon your pain threshold. It depends upon your immune system. It depends upon your body per se. You know, I didn't have, in fact, I felt better after 2 doses. After every dose, I was feeling better. You know, and my colleagues who took it were suffering with pain and didn't come to work. So I think a lot of it is in the mind as well, madam. You know, so
What is the people with the stunt? Does it affect them?
sorry,
Vaccination,
madam?
people who have the stunt, angiogram.
I didn't
People who have
understand
the
that, madam.
stunt.
Oh, people with the stunt, madam, you should have the vaccination. Yes.
Okay. Thank you, sir.
ಹಲೋ ಸರ್, ನಾ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡ್ಬೋದಾ? ಶಾರದಾಮಣಿ ಅಂತ, ಬ್ಯಾಂಗ್ಳೂರ್.
ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ ಸರ್. ಇವಾಗ 2 ವ್ಯಾಕ್ಸಿನೇಷನ್ಸ್ ತಗೊಂಡಾಯ್ತು ನಂದು, 2 ಡೋಸಸ್. ಇವಾಗ ನೆಕ್ಸ್ಟ್ ನಿಂದು ಸ್ಟೀಮ್ ಇನ್ಹೇಲಿಂಗ್ ಎಲ್ಲ ಮಾಡ್ಬೇಕಾ ಸರ್ ಇವಾಗ ತಿರ್ಗಾನು ದಿನಾನು?
ನೋಡಿ ಮಾ, see, everything you do helps. What is actually putting back is some amount of discipline in our lives. ಮನೆಗೆ ಹೋಗ್ತಿದ್ದಾಗೆ ಕೈ ಕಾಲು ತೊಳ್ಕೊಳ್ಳೋದು, ಸ್ಟೀಮ್ ಇನ್ಹಲೇಷನ್ ಮಾಡೋದು, ಹೆಲ್ತಿ ಫುಡ್ ತಿನ್ನೋದು, ಅನಾವಶ್ಯಕವಾಗಿ ರೋಡ್ ಸೈಡ್ ತಿಂದೇ ಇರ್ತಕ್ಕಂಥದ್ದು, ವಾಕ್ ಮಾಡ್ತಕ್ಕಂಥದ್ದು. ಸೊ ಸಿ, once you're immune, I wouldn't let my guard down. ಹಂಗಂತ ಹೇಳಿ ಪಾರ್ಟಿ ಮಾಡ್ಲಿಕ್ಕೆ ಮಾಸ್ಕ್ ತೆಗೆದು ಎಲ್ಲಾ ಕಡೆ ಹೋಗೋದು ತಪ್ಪು.
ನನ್ 75 ಇಯರ್ಸ್ ಸರ್, ನಾನು ಈಗ ವಾಕು ಬಿಟ್ಬಿಟ್ಟಿದೀನಿ ಸರ್, ಭಯಕ್ಕೆ ಇದೆಲ್ಲ ನೋಡಿ ಐ ಆಮ್ ನಾಟ್ ವಾಕಿಂಗ್ ಇನ್ ದ ಹೌಸ್ ಇಟ್ ಸೆಲ್ಫ್. ನಾನು ಮನೇಲಿ ಇದ್ದೀನಿ.
ಹಾಗಾಗಿ ನಾನು ನಿಮ್ಗೆ ಹೇಳಿದ್ದು ಮೂಲತಃ ಭೂತಕ್ಕಿಂತ ಭೀತಿ ಹೆಚ್ಚು ಅಂತ. ಸೊ ಯು ಶುಡ್ ಶಟ್ ದ ಫಿಯರ್. I'll take you back to the statistics. 100 people with COVID, nearly 98 people get better and go home, or at least are safe. 1 person might die out of this 100, madam. So 90 of them will recover. So I would say lose the fear and start doing things, but with safe precautions. That's what I would say.
ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು ಸರ್ ನಿಮ್ ಸ್ಪೀಚ್. ನಂಗೆ ಕೆಲವೆಲ್ಲ ಪಾಯಿಂಟ್ಸ್ ತುಂಬಾ ಕನ್ಫ್ಯೂಷನ್ ಇತ್ತು. ಇಟ್ ಈಸ್ ಕ್ಲಿಯರ್ ನೌ ಸರ್.
Thank you, madam. I'm very grateful.
ಶಾರದಾಮಣಿ from Bangalore.
Last question. Do you have to go for any test?
Any test?
Whether it has worked on us or not, to find out?
Madam, it depends upon the personality, madam. If you want to be sure your antibodies are high and your body has responded, you can go and get a test done. It costs you 250 rupees. Some people say, anyway, I'm vaccinated, why worry or why bother? And you can leave it. So it's all in the mind, madam. But personally, would I get it checked? Yes, I would get it checked. If there is a problem after 2 vaccinations and you're getting some fever or temperature or whatever, then you go and get it checked to see whether you got good enough antibodies for the whole process. Not routinely you test it, it's tested as and when required based on the indication. I hope that answers your question, madam.
So can you give your number, please?
It is not here, but can we go for a walk on the terrace?
100% you should, madam.
सवाल भी पूछे.
Very nice session.
You cannot stop living life. So I will just give my number and then I'll put my regards to you before I close the session, madam. To start with, it has been a real honor to share my thoughts both on cancers as well as COVID to your kind selves. So I'm really grateful to Mukta and the Dignity Foundation for giving me this opportunity. Secondly, this is my contact number. So I work at Apollo Hospitals, Bangalore. I'm based at Bannerghatta Road. Please jot down my number. It's 819 70 884 34. So it's up there on the message as well, 81970888434. So please send me a message or any questions. If I can be of help, I will certainly do that.
Thank you, sir.
Sir, can you repeat the number, sir? Can you repeat the number?
81970888434, sir.
Thank you, sir.
Please repeat the number. Please can you repeat the number?
1970.
So well.
88434, madam.
Okay, so
8843.
And I also have a website if you want to log in and find out more about what I do. It's called as BangaloreBowelCare.com. So it is something that you could do if you have the access, madam. So with this, I'm really grateful to one and all. Mukta, I'm very, very grateful to you for giving
Thank
me
you,
this
sir.
opportunity.
Let me thank you, sir, before you leave the session. Thank you so much for being very patient in answering our members' queries. And I'm really thankful for you for the first session on cancer. What are the symptoms, how to diagnose, and how to take right advice at the right time. So, and the second session was actually the present situation COVID session you took, and you gave a lot of information on many members were in a dilemma whether to take a vaccine or not. That question also is cleared now. So thank you very much for joining us. And first of all, I would like to thank our Brunda ma'am, chapter head, because she was the one who gave me your reference. And thank you, the head office team, for being with us all the time in doing the All India sessions. Thank you so much, sir. It was a wonderful evening we had. And Rick, thank you, sir.
Thank you, madam. Thank you, Brenda. Thank you. Thank you. Thank you.